Absolutely. I'm actually going to invite Gail and Joseph to turn on their cameras and microphones because we'd love to hear a little bit about your experience as real patients who have experienced maintenance therapy. Gail, do you wanna tell us a little bit since you follow Petros's slides so closely?
Hi, my name's Gail Dykstra. In disclosure, I am a patient at the University of Washington SCCA, and Dr. Grievous is my medical oncologist. I was diagnosed with muscle invasive bladder cancer T2 and 3 at the end of 2017. The tumor was removed and staging occurred in January. As a result of a cardiac issue, I was deemed ineligible for chemotherapy, for radiation, and/or for surgery, and was only able to avail myself of immunotherapy, which I knew absolutely nothing about. And the confidence that I have in the treatment I have received is in great part due to Dr. Grievous and the UW SCCA team. And I want to give a shout out to BCAN, because at a time when I knew nothing and needed a great deal of information coming at me in language I could understand and with compassion, BCAN was there. And I think that talking about treatment and maintenance is another example of why BCAN is so important to all of us. I was treated with pembrolizumab alone, and over a course of an initial treatment that normally takes about 2 years. I am now in the maintenance section of it. And at the point where I needed to make a decision and talk with Dr. Grievous and the team at SCCA about what next, I had all of the what if questions, what if it comes back? Even though I'd had immediate response in a very positive manner to immunotherapy. And although I had some side effects, they were manageable, they were identified, and they were monitored all the way along. I still had the what if it comes back? What do I do now? Do I continue? Do I not continue? There's not a great deal of data at this point, as Dr. Grievous was talking about. UW, SCCA, and others are studying what happens to patients who have just had immunotherapy. How long lasting is the treatment? So, because I'd had a good response, because the side effects were manageable, and that I knew that they would be monitored and managed by the team, I opted to continue and am into year 3 of my treatment. I continue to get CT scans every 3 months. Of course, I have a cystoscopy on a regular basis, and continue to keep become aware of any possible side effects that have grown or changed. And so far, they have been good. One other thing that was a big part of my decision is that the cost of immunotherapy, as all cancer patients know, all cancer treatments are expensive. Immunotherapy is enormously expensive. I needed to know in advance whether my insurance would cover that cost, because if it didn't, I would not be able to make the kind of decision that I was able to make. Um, the the thing that I would think that is the most important is to be able to know what you are going to be personally, emotionally comfortable with. would I be comfortable just cutting off the immunotherapy at the initial stage? I didn't think so. I wanted to be able to wait until more data was going to develop so that I had a better appreciation of the long lasting benefits.
Great. Thank you so much for sharing your story with us, Gail. We really appreciate that. Joseph, you're on the other end of this spectrum with non-muscle invasive bladder cancer. Would you like to share your story about BCG maintenance?
Yes, thank you for having me. I beg your pardon. I just had surgery Monday. My cancer returned and was very disappointed. I am 2 years out with TACIS. I had a recurrence on Thursday and Monday I had surgery. So we've done a biopsy and a resection. So hopefully I'll still be non-invasive. I live in Palm Springs, and one of the challenges has been for me is that I belong to Kaiser Permanente, which is the largest HMO in the country. Unfortunately, this is a service area, so I can't get care here in Palm Springs. So I am forced to travel for all maintenance and for induction to either a Fontana, California, or Ontario, or Riverside. They're about 50 to 70 miles away, each of them. So it's very challenging for me to drive to the medical centers and then drive back after I've had BCG, holding it in the car. I actually had a problem. My original surgery was in San Diego. And on the way back, I actually had to jump, take a jump in the trees because I had a lot of problems with that. I want to say that maintenance for me was not really a decision that I could ignore. I have CIS, and it's responsive very well to BCG. So there wasn't for any moment a consideration of anything else. The treatment results have been okay, good until unfortunately Thursday. Not positive what my doctor will do now, and will be interesting to see what that tumor was. So for me, the difficulty with BCG has been the painful urination afterward. That is probably the hardest. I found that for me, I was very nervous about it. So I looked into YouTube, and I looked into the Bladder Cancer Advocacy Network Inspire list, which I encourage people to please go on because the members are wonderful, and we all try to help all new people, and those that are getting BCG are afraid, and I was too. So that was very helpful to me. And when I received the treatment, I was surprised that it wasn't as bad as I thought it would be. I'm a person that was a registered nurse at one time and actually was on the other side. But getting the catheters as often as I get them has been very challenging because it is painful to get a catheter each time they do it. And I've had so many. And right now I'm having a pain from the one I have now at this point. In terms of, I'm just trying to look at some of the questions. In terms of my maintenance, I have been very lucky. Kaiser Permanente has a policy system-wide of giving 1/3 dose. They have felt that that's the fairest way to do it. But my case is it's been that the last 6 doses, I've had 18, have all been full strength BCG, which is unusual for a maintenance program. So I've been very grateful that I've achieved that. The nurses are wonderful, I have to say, particularly a woman named Maria. She's been terrific. Also for me, I guess maybe the biggest problem, and I think for those of us in the bladder cancer community, has been the shock of it, and then trying to work through the emotions. This came about through a cystoscopy that my urologist in San Diego was doing because I was going to have a urolift. It's a prostate surgery. That's all I knew. We were going to do that. He's the only one of the doctors in the country that would do this. And he said, I found a little something here. I don't know what it is, but we'll biopsy later. I don't think it's anything. And then called me a week later and said I had bladder cancer. So it's one of the things that I, as a person, had no knowledge about. absolutely knew nothing about maintenance, didn't know TA, I didn't know any of these things. And that was very difficult. And the physician I started off with originally was not helpful in that regard. Um, a lot of the physicians have great clinical skills, but in terms of their ability to tell us about these maintenance therapies and those things, my doctor right now is an oncologist urologist. He has given me a lot of information, more so than the other doctor. And I've gone to support groups and they've given me some information. Dr. Shuckman at USC, I have met with, and she's a world famous uro-oncologist. And for those cases, I've been very grateful because he's giving me statistics. What is it with BCG? What isn't it with BCG? What are the chances of your recurrence? What kind of things do we look at? And this has been, it's really a challenge. But for me, the question came up, well, was this, was this difficult for me in terms of my scheduling, things like that. The entire illness has been nothing but a rescheduling for me. My whole life changed March 26, 2019. My whole life is never the same and never will be. But I have learned to cope with this. It is always over my head. And those of us in the bladder cancer community always say we're part of a club we didn't want to join. And so this is something that has really guided me through all of my treatment, through my original surgeries and my initial induction, and now the maintenance that I do. I'm very grateful to Kaiser because they did have this policy. There are many people in my BCAN group who can't even get, even for the induction, they've had a hard time getting the 6 doses of BCG. So in any way, I won't speak any longer, but I thank you for giving me the opportunity to talk about this. And I am starting a support group, by the way, for non-invasive muscle bladder cancer patients. Thank you.
Thank you, Joseph. Thanks so much for sharing your story, and we're looking forward to that support group. I know that'll be a great thing in the bladder cancer community.